Well, I sure as hell didn't have this one on my compounding bingo card. Today, Novo Nordisk has formally asked the FDA to remove semaglutide from the FDA shortage list. Now, what does that mean for you? That means that if Novo Nordisk gets its way, that semaglutide, compounded semaglutide, will no longer be available for sale legally in the United States at 503A pharmacies and 503B pharmacies. Now, we're currently going through this with Tirzepatide. Let's just break down everything that's happened since August 2nd, because it might give us a feel as to what might go down with semaglutide. So on August 2nd, Eli Lilly marked all doses available. August 8th, they announced releasing of the vials. August 27th, the prices were announced for those vials at the bargain price of $3.99 for 2.5 and $5.49, $1 off for their 5 milligrams, but did open it up to people that are on government insurance. On September 4th, Eli Lilly sued the FDA over whether retatrutide should be classified as a biologic. If Eli Lilly gets its way and they win this case and retatrutide gets classified as a biologic, that means that retatrutide, the drug that so many of us are waiting for and the anticipation for is so heightened, will never, under U.S. law, be able to be compounded ever. Shortage or no shortage. And inherently, a biologic medication is XXX times the price as normal pharmaceutical medications. On 10/2, the FDA says, you know what, Eli Lilly, since you just gave us all of your data and we didn't have to gather any of our own under our current rules and regulations, you're right, it is out of shortage. So they removed it from the shortage list, sending 503A pharmacies and 503B pharmacies and telehealth companies around the entire country absolutely panicking, along with millions of patients. On 10/8, the OFA files a lawsuit with a TRO, a temporary restraining order, against the FDA. 10/11, the FDA asks for a stay or a reconsideration that they're going to come back and reevaluate their decision with further evidence. On 10/17, after the APC, the Alliance for Pharmacy Compounding, was seeking further clarifications to whether 503A pharmacies could still distribute API that they receive from 503B pharmacies. The FDA says right now, during this time, we're not going to punish everybody. Everybody will be treated equal. So 503As and 503B pharmacies were able to keep on producing compounded Tirzepatide for all of us. On 10/21, Eli Lilly sues 2 med spas and 1 research grade Tirzepatide facility. 10/21, Novo Nordisk asked that semaglutide be added to the DDC, the demonstrably difficult to compound list for the FDA. Not even, meaning that it's too dangerous for you to compound because it's just even though it's been on the market for 2 years, now it's too dangerous. Just 8 days later, we find out from Bloomberg Magazine that the Ozempic plant was cited for not being able to prove that it has clean and sterile water. We'll get to the DCC stuff later. And then today, we find out that semaglutide was self-reported by Novo Nordisk to be taken off of the FDA shortage list. Did you get all that? I literally just want to be healthy. I did not want to turn into a pharmaceutical investigator. Just want to get healthy. It's a lot. Before we get into all of this, I am Candace Cunningham. I have lost 108 pounds in 9.5 months on GLP-1 medications. I've been on branded and I've been on compounded, both Tirzepatide and semaglutide. If GLP-1 medications are important to you, if you could do me a favor and do a no-cost option and support this channel by just hitting subscribe and just hitting like, that's all I ask of you. And thank you so much for all the return visitors. So where does that leave us timeline-wise? Let's just go by the same timeline that was laid out with Tirzepatide. Tirzepatide was declared off shortage by Eli Lilly on August 2nd. 61 days later, on October 2nd, the FDA said, okay, shortage resolved. So 61 days from today puts us at December 31st. Now, granted, there are federal holidays in there. We have Christmas, Thanksgiving, but let's just go with December 31st. What we would hope that would happen is that the FDA would extend the same courtesy, because the U.S. law just says strictly 503B pharmacies can off-ramp for 60 days, and 503A pharmacies must cease immediately the day it's announced. But let's just say, because it's a blockbuster drug that millions of Americans are on, let's assume that let's hope that they gave it the same courtesy and give that 60-day off-ramp. That puts us like right at the beginning of March. Very end of February, very beginning of March is, in my head, the absolute worst case scenario of when semaglutide could potentially come off of the shortage list. There are so many unknowns. What I think is going to happen is, I think that nothing will happen until November 21st, when the OFA and the FDA have to come with their joint status report in front of this Federal District Court of Texas, North Texas, and deliver their status report. And I think a lot will depend on what that hearing has to do or has to say, and how the FDA might proceed. A couple things could happen at that hearing. Remember, the FDA, under its own rules, can only consider Eli Lilly's information at the time to declare if it's out of shortage or in shortage of any manufacturer for any drug. During that discovery period, the FDA was able to collect more data from the outsourcing facilities, the 503B pharmacies, at that time, and now they might make a better determination of whether it's in shortage or out of shortage. Best case scenario on the 21st is the FDA says, you know what, we've reevaluated everything, and Tirzepatide is indeed still in shortage, and then they mark it back in shortage on the FDA shortage list. Worst case scenario is the FDA comes back and says, hey, it's not in shortage, and then the OFA can figure out how they're going to continue their lawsuit, and then we can figure out what the legal status is at 503A and 503B facilities. Not particularly what your telehealth is going to do, if they're just going to yellow it, like, come at me, bro, like a lot of them did this time, but like what the legal ramifications are. And for the record, like, all your telehealth companies are just like, we're going to do it till the cops knock the door in. I don't care. That's a them problem, not a me problem. If they're still willing to send me the Tirzepatide and they're willing to get sued for it, that's them. Who cares? Take your medicine and run. That's great for us. But, and then also the FDA and the OFA could say, hey, you know what? Here's our joint status report, and we need more time. And hopefully with all the holidays, that could push the court date into the new year. That would be the Band-Aid solution or the best solution, whatever. And that would at least give us more time. I don't think that the FDA, given the amount of press this has gotten and how this is now in the court of public opinion, and I'm sure the letters and just the craziness that's surrounding all of this, I don't feel personally as if the FDA will move heavy and fast on semaglutide, because let's face it, semaglutide is so much more affordable than Tirzepatide, compounded even, that there are so many millions more Americans on compounded semaglutide than there is Tirzepatide. I don't think they're going to do anything until the 21st. I could be wrong, but I don't think that they're going to do anything until the 21st. But you can bet your sweet ass that the war is on. They're coming at this from every direction. And if you listen to the earnings call today from Eli Lilly, oh, they don't need your money. They don't need the compounders' money. That has nothing to do with their earning reports.
Do you believe that compounded drugs are impacting demand? And, secondarily, how do you frame kind of the FDA's waffling on the shortage list as it relates to compounding? It seems that this has been a hot button issue. I'd love your perspective. Thank you so much.
So from our perspective, we actually don't estimate there to be a huge financial impact of compounding on our business, but our major concern here has been driven by safety, that thousands of people in the US are getting medicine that is not approved by the FDA for quality, safety, or efficacy purposes. So that has been our concern, and we are mainly leaning in now, as we said earlier, to drive demand in the US marketplace for patients with obesity and type 2 diabetes.
Yeah, bullshit. This is all about money and greed. Eli Lilly was involved in two of the biggest pharmaceutical lawsuits in United States history. They got a patent for insulin for like $1 or $10, jacked up the price of insulin so high that senior citizens couldn't afford to pay for their medication and people died. They trained their pharmaceutical sales reps to go into nursing facilities and get doctors to prescribe bipolar 2 medications to people that had dementia. This is all about greed. And all we're trying to do is get healthy. The obesity rate for the first time since the 70s has declined because of these miracle drugs. And you heard them. They don't need our money. So leave us alone just for like a little bit. Jesus. We found out that Eli Lilly and Novo Nordisk have submitted semaglutide and Tirzepatide to the DDC list, demonstrably difficult to compound list for the FDA. And what does that mean? That means if a drug ends up on the DDC, it is no longer allowed to be compounded, period. I got this letter from Scott Bruner, the CEO of the Alliance for Pharmacy Compounding. And let me just quote you what Scott said. So let me get this straight. So Novo Nordisk is apparently so deeply concerned about patient safety that it's taken them a whopping 2.5 years while their drug has been in shortage to conclude that semaglutide's API is so demonstrably difficult for compounding pharmacies to prepare that the FDA now needs to place it off limits for compounding. To me, this sounds more like a desperation and an attempt by Novo Nordisk to protect its revenue stream than a serious scientific argument. He's right. Scott is right. 2.5 years, and now it's too dangerous? It's too dangerous. You guys can't even get your damn water under control at your biggest flagship facility. Maybe it's too demonstrably difficult for you to make. This was so many people's plan B. I think so many of us creators said that, well, if Tirzepatide comes off the market, that's why I went on semaglutide for 6 weeks so I could tell you guys that if it was good or if it wasn't good, and I could feel for you when you had to make the switch over to semaglutide from Tirzepatide if it got removed from the shortage list. I took 6 weeks of my own journey to do that experiment for this channel so I could report back. It was so many people's plan B. I want to hear, what is your plan B? What are you planning to do? Or has this even sunken in that this might be our reality? Because it hasn't sunken into me. What are some of the steps that you can take now to feel like you have some type of power? I know there's a lot of you that have never explored the option of your insurance company. Open enrollment is right around the corner if you're not in open enrollment right now. Open enrollment is right around the corner. Your formularies could change once January rolls around, but it's a good idea to see if weight loss GLP-1s or diabetic GLP-1s are on your formulary for your insurance. If you have a choice for multiple insurance plans, maybe it's time to start making those decisions with your family. A lot of you are with telehealth companies that offer PAs. I rep for Pomegranate. They have a service that does PAs. Join Fridays is another company that I know that they have a program service that writes PAs for GLP-1 medications. And if you have a telehealth company and they write PAs and they take you through the PA process, could you just list it down below and help your fellow community members out? Now is the time to start calling those telehealth companies that you've been paying for and get in gear and get your PAs, get your blood work done. Do all of the things. If your insurance says I will cover this Wegovy, but I won't cover Zepbound, get on something. Something is going to be better than nothing. And a lot of those programs require step therapy, and some of those step therapies could take 6 months. We might have 6 months. Why not start the process? Get it going. Document everything. Start food journaling. Start weighing yourself on the scale. Might be triggering some of you. You know what else is triggering? $550 a month. That's triggering. Start documenting your journey. You have to prepare your war plan. Just like on South Park, we're like living the South Park episode. You get to navigate the American healthcare system.
We want to file a claim to get my friend's weight loss drugs paid for.
Sorry, but we don't pay for medicines for obesity because it's not a disease.
Look, my friend's mom has been paying you people for years, and his doctor says his weight is a medical concern and obesity is a disease. Oprah Winfrey said so.
So all you have to do is navigate the American healthcare system.
On a very personal note, I know I usually end this with like, hey, it's Candace and the T on GLP, but on a very personal note, I want to say how sorry I am that oh my gosh, I think I'm gonna cry. On a very personal note, I just want to say how sorry I am that I know firsthand what it feels like to finally have something for the first time in your entire life that works. And there's a real possibility that our access for millions of Americans is going to go away. Like, that's a very real possibility. And it's just genuinely not fair. I'm proud of you for all the work that you've put in, that you've made it this far. And hopefully we can figure something out together. But you're going to do it. We're going to kick ass. But it's not going to be the easiest path. And it just sucks. We're literally fighting for our lives. But you're doing a good job. We're doing a good job. And it's not over. It's not over to this ex-fat lady sings. But yeah. I don't even know how to end it. Just make sure you subscribe and stay tuned. And if you have any tips or comments, just put them below. But this is the Candace, and thank you for joining me on the T on GLP.